Hello, how you doing?
Hi.
My name is Matthew. I'll be your nurse for today.
My name is Jessica.
Nice to meet you. I'm just gonna ask you a few questions regarding your health. Is that okay?
That's fine.
Okay. Can you please verify your full name and your date of birth, please?
My name is Jessica Fiallo. I was born 06/17/1998.
Okay. Do you know where you are right now?
I'm at the doctor's office.
Okay. You know today's date?
Today's February 28th, 2025.
Okay. Do you know why you're here today?
To have a wellness check.
Okay, perfect. I'm just gonna ask you a few questions regarding your health. Is that okay?
That's fine.
Okay. Are you taking any medications right now?
No.
Okay. And what does your diet and exercise usually consist of on a weekly basis?
I try to eat at least 5 servings of fruits and vegetables. I get in my protein. I have low on the carbohydrates, and I exercise about 3 times a week.
Okay, perfect. So the patient appears stated age, level of consciousness is awake color in orange times 4, self-placed time and situation. Skin color is relative to ethnicity, posture is comfortably erect, and there's no physical deformities observed. Miss Jessica, I'm gonna check your vital signs really quick. Is that okay?
That's fine.
Okay. First thing I'm gonna do is check your blood pressure.
Okay.
Let me put on my gloves. Okay. As I'm checking her blood pressure, I'm gonna be checking her respiration. Okay, blood pressure is 113/68, pulse rate 93. I'm rechecking your temperature now. Can you please lift up your knob under your tongue? Okay, and close. Okay, temperature is 97.7 oral. It's within normal range. Okay, now we're gonna check your weight and your height, okay? Okay, Jessica, please stand on the scale for me. Okay, weight is 113. Now we're gonna check her height. Please stand up straight against the wall. Okay, height is 63 inches, which is 5'3". Okay, Jessica, I'm gonna ask you some questions about your vision. Is that okay?
Yes.
Okay, do you wear any contacts along with your glasses?
No.
Okay, when was the last time you saw the eye doctor?
A year ago.
Okay, hearing is adequate, speech is clear, and personal hygiene is clean. Next, what we're gonna do is we're gonna assess your head and your face. Can you ask you to take your glasses off, please? Okay, we're gonna inspect and palpate your head. Is that okay?
It's fine.
Okay. Inspecting for any masses, any lesions, looking for any lice in her hair. None of that is noted. Okay, perfect. Now we're gonna inspect her face for any symmetry. We're checking for any drooping. No drooping noted. Now we're gonna assess for cranial nerve 7. Can I please ask you to close your eyes tightly for me? And then open, smile, frown, puff out your cheeks. Okay, perfect. Cranial nerve 7 is intact. Now I'm gonna palpate your temporal artery. This is adjacent to your eyes. Okay, perfect. Now I'm gonna assess the temporal mandibular joint. Can you please open your jaw? Okay, perfect, and close. Perfect. Now I'm gonna assess the maxillary and frontal sinuses. Do you have any pain?
No.
And then here, do you have any pain?
No.
Okay. Now we're gonna inspect her eyelids, her sclera, and her pupils. Her scleras are white, and her conjunctiva is pink. Now we're gonna assess for cranial nerve number 3. We're gonna hold the pen light in front of you, okay? I'm gonna ask you to follow the pen, okay? I'm gonna go into an X shape. As I'm doing this, I'm monitoring for any nystagmus or involuntary shaking of the eyes. Okay, perfect. Now I'm gonna bring it closer to you. As I'm doing this, I'm checking for accommodation. Okay, perfect. Now I'm gonna check her pupils. Okay, perfect. And pupils are equal, round, and reactive to light and accommodation. Now I'm gonna be inspecting and palpating your ears, okay? As I'm doing this, I'm checking for any redness. I'm palpating for any masses, any bumps, any tenderness. I'm gonna palpate the tardus. Do you have any pain?
No.
Okay, perfect. I'm gonna do this here. Same thing, I'm checking for any masses, any redness, any drainage. I'm palpate the tardus. Do you have any pain?
No.
Okay, perfect. Now I'm gonna inspect your nose. Nose is midline. The septum does not have any deviation, no lesions. Do you have any drainage?
No.
Okay, now I'm gonna assess for patency. Can you please close one nostril and then blow air? Okay, perfect. And then do the other one for me. Okay, perfect. Now I'm gonna inspect for any polyps or masses inside your nose.
Oh.
Okay, and now your mouth. Okay, perfect. I'm checking for any masses, any polyps, any redness. Lift up your tongue for me. Okay, perfect. And then uvula is midline. Now we're gonna assess for cranial nerve 12. I'm gonna use my tongue depressor. Can you please open and say ah? Okay, I'm gonna press onto your uvula.
Oh.
Okay, gag reflex is intact. Tonsils are great too. Now I'm gonna inspect your neck. Can you please look up for me? Okay, and now as I'm doing this, I'm checking for any lesions or bumps. Trachea is midline. Is there any tenderness when I palpate? Do you feel any tenderness?
No.
Okay, perfect. Now we're gonna palpate the lymph nodes. As I'm doing this, I'm checking for any tenderness, any masses. Do you have any pain as I do this?
No.
Okay, perfect. Perfect. Now I'm gonna palpate your carotid. Can you please look up for me? Okay, carotid is 2+. I'm gonna check the other one with the opposite hand. Okay, perfect. Now I'm gonna hold my hands against your head. Can you please look left and right? Okay, perfect. And then look up and down. And then shrug. Okay, cranial nerve 11 is intact. Okay, now we're gonna palpate your thyroid gland. I'm feeling for any masses. Okay, perfect. Now we're gonna assess your lungs, okay?
Okay.
So as I'm doing this, I'm gonna inspect your respirations and I'm gonna palpate for tactile fremitus. So I'm gonna place my hands here. Can you please say 99 for me?
99.
Okay, say it again.
99.
Okay, say it again.
99.
Okay, one more time.
99.
Okay, perfect. Now we're gonna also take your lung sounds. Can you please take a deep breath for me? Can you turn around for me, please? Okay, now we're gonna assess for your heart. I'm gonna inspect your precordium for any pulsations. I'm gonna palpate to see if I feel any abnormal thrills or lifts. Okay, perfect. Now I'm gonna palpate your apical pulse. It's getting the fifth intercostal space and the midclavicular line. Okay, perfect. Now I'm gonna auscultate your apical rate. Okay, normal rate and rhythm. I'm listening to your other heart sounds. The tricuspid. Okay, perfect. Normal rate and rhythm. Now we're gonna palpate your bilateral radial pulses. Can I please see your arms? Okay, perfect. Okay, pulses are 2 plus and equal. I'm gonna assess your capillary refill. Perfect. Okay, perfect. And her bilateral hands are clean and intact. Scales are of normal length. Now we're gonna assess your skin turgor. Can I please see your hand again? I'm sorry. Okay, perfect. Perfect. And I'm gonna see your hands. I'm gonna check for range of motion of your fingers. Okay, perfect. Okay, perfect. Do you have any pain or tenderness when I do that?
No.
Okay, can you please pull up your sleeves so I can check your bilateral brachialis pulses? Okay, perfect. 2 plus and equal. Now I'm gonna assess for your strength. Can you please squeeze 2 of my fingers as hard as you can? Okay, perfect. Now I'm gonna grab your wrist. Can you please push against me? Okay, perfect. 5 plus normal strength. I'm gonna grab your elbow. I'm gonna go up and down. As I'm doing this, I'm checking for any clicking or grinding. As I'm doing this, I'm checking for the epitrochlear nodes. I'm checking for any clicking and none noted. Okay, hold out your arms in front of me like this and close your eyes. I'm gonna wait a few seconds. I'm checking to see if there's any drifts, to see if one arm goes up or down as opposed to the other one. Okay, no drift, no. Okay, and now I'm gonna assess for your abdomen. I'm inspecting her abdomen for color, masses, or hernias. None of that is noted. Do you have any abdominal pain?
No.
Okay, when was your last bowel movement?
This morning.
Okay, your last menstrual period?
Yesterday.
Okay, do you have any pain or burning upon urination?
No.
Okay, I'm gonna auscultate your bowel sounds in a clockwise manner. We're gonna start in the right lower quadrant. Okay, bowel sounds are active in all 4 quadrants. Now we're gonna auscultate the aorta artery. We're gonna use the bell of the stethoscope. Okay, no Bruit's heard. Now we're gonna assess the renal arteries. Okay, no Bruit's heard. Now we're gonna assess the iliac arteries. Okay, everything is within normal limits. Now we're going to percuss the 4 quadrants, starting on the right lower quadrant. Okay, we're hearing tympany over the intestines and the bladder, and dullness over the organs such as the liver, which is in the right upper quadrant, and the spleen, which is in the left upper quadrant. Now we're going to have some light palpation. This is going to be approximately 2 centimeters deep. Here we're feeling for any pain or tenderness. Do you have any pain?
No.
Okay, perfect. Okay, now we're gonna have deep palpation. These are 4 to 5 centimeters. Do you have any pain or tenderness? Any pain or tenderness?
No.
Okay, now we're gonna assess the lower extremities. We're inspecting the color of the legs. We're monitoring for any swelling, any abnormal hair growth, any varicose veins, Toenails are clean and of normal length. Now we're gonna palpate the popliteal pulses. These are behind the knees. Okay, pulses are 2+ strength. Now we're gonna palpate the posterior tibial behind the ankle. Okay, these are 2+ strength as well. Now we're gonna do the pedal pulses on top of the foot. Okay, these are 2+ strength as well. Now we're gonna check for capillary refill in the toes. Press, okay. Okay, there's normal refill into both, less than 2 seconds. Now we're gonna assess for range of motion. I'm gonna push my hand against your foot. We're gonna push it up. Okay, perfect. Now can you push your ankles against my hand? Okay, perfect. And do the same thing over this one. Okay, perfect. And then push against my hand. Okay, perfect. Now I'm gonna check in between her toes. We're checking for cleanliness, any wounds, any sores. Everything is intact. Next, we're gonna test the Babinski reflex. So I'm gonna run my tongue depressor against your foot. And the normal reflex is the curl of the toes. Okay, perfect. Okay, perfect. Okay, Miss Jessica, now we're gonna assess for your mobility. Can you please stand up? I'm gonna ask you to walk to that door in a heel-to-heel fashion. Okay, perfect. Can you walk back? Can you take a few steps on your tippy toes? Okay, perfect. Now we're gonna perform the Romberg test. So please stand here. Now please put your feet together and close your eyes. And I'm gonna monitor your balance. Let me know if you feel like you're losing your balance. Okay, perfect. Now we're gonna perform the knee bend test. So what I'm gonna ask you to do is I'm gonna ask you to hold onto this chair and lift one leg up, and then you're gonna squat with the one leg that's on the floor. Okay, and then switch. Okay, perfect. Now I'm gonna ask you to please touch your toes, and I'm gonna feel your spine. Okay, perfect. I'm gonna come back up. Okay, perfect. Spine is aligned. Okay, Jessica, this would conclude our head to toe assessment. Everything is within normal limits. Did you have any questions or concerns?
No, thank you very much.
Okay, thank you for your time, and feel free to let me know if you have any questions in the future. Thank you.